So today's topic is Therapeutic Diets, chapter 12 to 31, page number in dietetics textbook, those who have the new textbook. So before starting the therapeutic diet, please remember, majority of what we are going to discuss today is a part of clinical nutrition. What practices we will discuss today is a part of clinical nutrition. Those who are not from a clinical background, this is just for your knowledge, for your information. Okay, those who are already working in the clinical background, okay, they will have more insight. They will have the opportunity to practice this therapeutic diet. Okay, therapeutic diet at home also it can be given, that comes under the dietitian's umbrella, but the ones that are given in a hospital setting or any healthcare setting, okay, it comes under clinical nutrition. It should be practiced and be carried out only by professionals, okay, under the prescription of them, or even like nurses as well. Okay, these are the professionals who are bestowed about with to carry out the therapeutic diets. Okay, so we'll continue the chapter. Therapeutic diet is a qualitative or quantitative modified version of a normal regular diet, which has been tailored to suit the changing nutritional needs of a patient or individual and are used to improve specific health or disease conditions. Therapeutic diet, in the name itself, you can understand this diet is supposed to support an ongoing medical management of a disease condition, or even for general specific health also, if there is uh, any backlogs in your health, just to correct that. A specific targeted diet is added, a specific targeted nutrition is added into your diet, okay, just to target and solve that problem. So that comes under therapeutic diet. It's a modified version of a regular diet. Even in terms of nutritional balance, or in terms of the consistency, the way how it is fed, the frequency of meals, okay, there is a large spectrum in which therapeutic diet can be manifested into the reality. Okay, so that's the meaning of therapeutic diet. Then we have immunonutrition. Okay, therapeutic diet, always remember, it is supposed to emphasize on your psychological and social needs of specific persons, who are people who are ill, and it is a simplified version of a balanced diet. And after the person gets completely okay, they are free of the disease or illness, they have to switch back to their balanced diet. Okay, therapeutic diet will be functioning only for a specific amount of time, in which they have to recover. During the recovery phase, therapeutic diet is given. After recovery, the person can be weaned back into the normal diet. Sometimes in therapeutic diet, you may have to remove certain nutrients, or in some cases, you have to add new nutrients. Okay, it works both the way. Immunonutrition diet supplements which are specifically targeted with arginine, glutamine, omega-3 fatty acids, nucleotides. Okay, they all are supposed to improve your immunity. Okay, so arginine, glutamine, okay, these all are amino acids, various other forms of amino acids, and nucleotides as well. Okay, omega-3 fatty acids, it's a lipid. So these all are substances which target your immunity, to better your immunity in general. Okay, the potential effect of am I audible? Is my screen visible? Am I audible? Is my screen visible? Okay. So immunonutrition, this is targeted specifically for patients who may be having multiple illnesses, okay, malnutrition, extremes of ages, who are on immunosuppressive drugs as well. For example, when for example a kidney transplantation or any transplantation is going on, patients are usually put on immunosuppressive drugs so that immunity is down, okay, and they are recovering from a transplantation, or they have or just now they are put out of immunosuppressive drugs, okay. At that point of time, immunonutrition is given. The food that is rich in all these elements are given, okay. Potential effect of immunity or inflammatory post-operative responses, and uh, splenic perfusion. Okay, these are the different conditions in which immunonutrition is required. Okay, what is the end point of this nutrition? What is the goal of this nutrition? Whenever there is a operation or any surgery going on, after the operation, the rate of the death rate or disease condition rate, for example, healthcare associated infections that takes place when a patient is admitted in hospital, okay, for a long time, or soon after surgery the patient gets an infection, okay. So to prevent these type of conditions, okay, to at a healthcare level, to prevent complications after surgery or even during the hospital stay, to prevent complications just because the patient's immunity is low. Naturally, when you are getting admitted in hospital, your immunity is considered to be low, okay. So what you see in immunosuppressive medications are given so that the patient's own body does not attack the new cells or tissues that has been transplanted, okay. Your body has a way to identify what is your own cells or tissues, or to identify what is somebody's donated cells or tissues which does not belong to your genetic material, okay. Your body is capable of identifying that. So the body does not know, your immunity does not know this transplantation has been done for the benefit of the patient, okay. It will only do its job of going and attacking this cells or new tissues and cells and destroying it, okay. And that will lead to complications in transplantation, okay. See, it's splenic perfusion is happens in your peritoneum, okay. Peritoneum means just under your abdomen, okay. It's a peritoneum is the cavity that in which all your organs are present, in the GI organs are present, okay. So splenic circulation means the blood supply that goes into your GI organs, or your liver, spleen, pancreas, okay. Splenic perfusion means sometimes a surgery happens in your intestine and intestinal contents get splashed around, or that goes inside the goes around, or it escapes through the GI tract, and it goes around the pancreas or wherever in the peritoneal cavity. It will perforate, okay. And that would lead to infection, that will lead to other complication, okay. That is splenic perfusion. Is it clear to all? These are medical terminologies. The questions related to this will not come. Okay. So in these situations, in these complicated situations, immunonutrition becomes important. Okay. So it's not given at a home care domiciliary level. It is given in a clinical setting. It's given in a healthcare setting. So arginine, it's an essential amino acid. Arginine is an essential amino acid which has an important role in maintaining the homeostasis in the body. That is, the body should not be too alkaline or too acidic. Okay, and it is prescribed usually when there is a stressful situation. For example, your surgery. Okay, any surgery that takes place, it's a stressful situation for your body. So during that, arginine is prescribed. It also improves your immunity by increasing the macrophage and phagocytic activity of your white blood cells, producing more neutrophils, that is white blood cells. Okay. So these are the way in which arginine supplementation can also increase the production of nitric acid, which can improve your vasodilation and hypotension. Vasodilation means the blood vessels get dilated so that the blood supply increases. Vasoconstriction means your blood vessels will get narrowed. It will undergo narrowing and the blood supply will reduce. Okay. After surgery, and specifically if an infection is taking place, you want vasodilation to take place so that majority of the blood cells arrive at that point and do the healing. Okay. So that is the function of arginine in immunonutrition. Nucleotide, these are important for making RNA and DNA, all the nucleotide based nutrition. To make more RNA and DNA within your body, nucleotides are required. Glutamine, that is a non-essential amino acid. Your body can produce a lot of glutamine on its own. Okay. And it is essential to recover your body from stress, severe stress. In case of multiple organ failure as well, patients who are admitted in ICU in critical stage with multiple organ failure, glutamine supplements can be prescribed as well to reduce the effect of stress. During sepsis, sepsis is a situation where not just one, but a majority of different species of bacteria or virus, okay, a lot of microbiome is attacking your body. That is sepsis. Okay. Infection caused by more than one or more than two different types of colonies of organism. It's called sepsis. In that situation as well, glutamine supplements are prescribed. Omega-3 fatty acids, as we all know, it is important for maintaining your immunity and it has anti-inflammatory effect. Specifically, omega-3 fatty acids has anti-inflammatory effect. So it improves your immunity. Coming to routine hospital diets, it is a spectrum. Okay, it starts with clear fluid diet soon after surgery, then full fluid diet, then soft solid diet, then the patient can move on to regular diet. Okay, so it goes in this particular step from clear fluid to regular diet. How do you move on? Okay, so clear fluid diet, it is made up of only clear fluids and foods that turn into clear fluids when they are at room temperature as well. So milk or dairy based anything is not given here. You have to completely avoid milk and dairy products here. Okay, even in room temperature, cooking temperature or room temperature, the clear fluid diet should maintain its clear color. Okay, strained juices, tea which does not have milk, black tea, okay, black coffee, clear broth. Okay, broth can be vegetable broth or mutton broth, chicken broth, whatever meat you have used for you to make your broth, that is also a clear fluid. So whenever there is an acute illness or soon after your surgery, okay, when you cannot digest solid food, when the patient is in a very critical situation where solid food cannot be given for digestion, in that situation, clear fluid is given. And also in situations like nausea, vomiting, anorexia, diarrhea, okay, it is advisable to restrict the intake of solid food and give the patient more clear liquid food. Okay, so there also clear fluid diet is mentioned. Okay, so clear fluid diet, these are the conditions in which it has to be given. Any acute infections, so short-term infection, acute inflammations, soon after surgery, to relieve thirst, to supply tissues with water, to aid in the removal of gas, that is flatulence. Okay, soon after surgery, the doctors and nurses will check if the patient has passed gas or not, flatulence or not. Okay, to aid that expulsion of gas, okay, flatulence part from the intestine, cleared fluid diet will help. Okay, the protein present in clear fluid diet, okay, it's not a protein that is going to cause harm to the patient, but it is going to help build more collagen. Okay, broth, if you know about this, bone broth or any animal broth is rich in collagen, and which the patient who has undergone surgery will require, because healing is required, wound healing is required. Okay, so the protein found in broth is rich in collagen. It aids in collagen production for the patient, and thus it accelerates the wound healing. Okay, there are different forms of protein. Okay, protein are basically amino acids, so different forms of proteins and amino acids are found in different versions of food. Okay, why we are avoiding milk, that is a specific reason. The milk could lead to intolerance. Milk and dairy products can cause more allergic reaction, inflammatory reaction, which is harmful. Okay, collagen can never be received from plant. No plant-based diet can give you collagen. Okay, collagen can only and only come from animal-based products. Plant-based collagen is not collagen, it's a collagen builder. You must have seen that vegan collagen or something, whatever is there, it is just collagen builder. These are nutrients that will promote your body to make more collagen, but you have to also take a lot of protein with that. Only then the collagen builder can work, which is plant-based. Plant-based collagen builder can only work when your diet also has enough amount of protein. Okay, so collagen builder will use the protein that you give through diet to your body to make more collagen in the body. But when you are using collagen supplements as it is only from animal-based products. Okay, the most common one is marine collagen, which the human body, hydrolyzed marine collagen, that is the one that human body readily accepts. It works very well for human body. It comes from fish source, not chicken, mutton, not beef or nothing. It comes from fish. Okay, fish scales specifically. Okay, so that is very well tolerated among the human gut. Okay, just give me a moment, 1 minute. Yeah. So the examples of clear fluid diet is shown in the textbook as well. You can give broth, you can give strained juices, anything that is clear in color. Tea, green tea can be given, black tea can be given, black coffee can be given, but it should not have milk. Milk is not suggested in clear fluid diet. Majority of the surgeries, because metabolism takes up a lot of energy. Okay, but the day one after surgery, day one, day two after surgery, we do not give any solid food to the patients, because we want to save the metabolic energy and put it into healing the patient. In eye surgery, it depends. Hard foods are not given even in eye surgery, after eye surgery, because the patient has to chew, right? Even after you have done eye surgery, your facial muscles will have to undergo the chewing and swallowing, etc., right? So that may also cause certain strain in your healing. No, if the patient had enough amount of water, if the patient is well hydrated, if the patient had some clear soup and everything, and later they are having black coffee or black tea, it will not cause any issue. Okay, as long as the patient's stomach is not empty, and you're not giving black coffee or tea on empty stomach, it should not give any issue. Then we have full fluid diet. Uh, so this diet, it will bridge the gap between the clear fluid diet and soft diet, and it is the middle step between solid food and clear liquid food. And all the food that are liquid, which we used in clear diet, that is also added here, and it should be at room temperature. And full fluid diet will add more calories than clear fluid diet. Definitely, you must have seen in previous slide, it was just 300 kilocalories. Here, full fluid diet can give you 1,200 kilocalories. Nutritionally, it is more inadequate. It is not adequate. Okay, it should only be used for very short periods of time. For example, 2 days or 3 days. Okay. Here we can add milk as well if it is suggested. Milk-based components can be added here. Soup is also added here. Okay. Everything that we have discussed in clear fluid diet, that plus milk-based liquid diet is added here. Smoothies. Okay. Next is the soft diet. 1,500 kilocalories, soft diet. 35 to 40 gram of protein is given. It is similar to the regular diet, but foods that require little chewing and be ready to digest. Foods to avoid is meat, coarse cereals, spicy food, rich desserts, fried fruit, raw fruit, veggies, nuts. Okay, these are the things you should avoid in soft diet. And again, soft diet is also used following surgery during the recovery period, specifically patients who have infections, digestive disorders, or chewing problems. Okay, they can undergo soft diet as well. Scrambled eggs, fruits, mixed fruit smoothies, oats, porridges, okay, mashed potatoes, okay, they all come under soft diet. It depends upon the patient's recovery, what kind of surgery the patient has undergone. Okay, for the patient who has undergone any gastric surgery, full fluid diet will be much longer. Okay, those who have undergone any other surgery like leg surgery, hand surgery, or any other form of surgery where the gastric GI tract is not involved, they will be put on full fluid diet for a very short period of time. Okay, so we do not have a tailor-made days on which the patient should be put on full fluid diet. It completely depends on, it is very subjective, what kind of surgery the patient had, what is the prophylaxis the patient is undergoing. Okay, so all these factors will come up. Next, then we have the regular normal diet. Again, this is easily digested. Maximum nourishment is given to the patient. Minimum effort. Simple food. Should not be too spicy, not be too seasoned food. Well-balanced nutrition. 1,800 to 2,000 kilocalories can be maintained. Protein content can be raised to 42 to 45 grams throughout the day, for the entire day. So as soon as the patient is on regular normal diet, it means the patient is ready to be discharged. So in a regular normal diet of 2,000 kilocalories, sometimes it looks somewhat like this based on the meal plan. Morning, a small breakfast, something light, midday meal, 11 a.m. A coconut juice or any juice, tender coconut water, tender coconut water or juice. Then 1 p.m. you can have lunch, 4 p.m. Snacks, or later at 6 p.m., 7 p.m. dinner. Okay, at least 5 meals per day. A regular normal diet can be maintained like this. All the other components, all the nutritional components is also mentioned. Nutrition support service, it's basically your healthcare team along with a dietitian. Okay, all the members in a healthcare team along with a dietitian, it becomes a nutrition support service. Okay, so the patient is the center of our care. In a healthcare setting or in a hospital setting, patient is the center of your care. Doctor, nurse, pharmacist, physiotherapist, okay, technicians, radiologist, anesthesiologist. If it is a surgery, surgeon and anesthesiologist will also be the part of healthcare team, and dietitian is also a part of healthcare team. Okay, so it becomes a nutritional support service. So nutritional support service, you have to identify if the patient was well nourished before, what is the current situation of the patient, what are the complications the patient is suffering from. Okay, any multi-organ dysfunction, infection, trauma, cancer. In these situations, specific nutritional support has to be given. Okay, identify the patients who have not been on good nutrition for the for at least for 1 week before they get admitted in the hospital. You have to correct their nutritional deficiencies, and then along with that you have to start the treatment. So you can't forget the nutritional deficiencies here. A patient who is malnourished, okay, again you have to put the patient out of a critical situation, like hypoglycemia, hypothermia. Okay, these comes under the critical situation, which comes along with malnutrition. Once this patient is safe, all the life threatening conditions have been eliminated, then the nutritional recovery can be targeted on. Okay, so that's the nutritional support service. It's basically what you do in a healthcare setting. Not, it is not done in a house, in a freelance setting or in a non-clinical setting. Only within a hospital, in a healthcare setting, these kind of support services are given. Coming to special feeding methods, you have enteral feeding, enteral nutrition, which means within or by the means of GI tract. That is what you eat through your mouth. Okay, and or if the patient is not having through mouth, through nasogastric tube, or various types of tube feeding, we will see that. Okay, various type of tube feeding can be used, but uh, enteral means food is entering the GI tract, any part of the GI tract, either your mouth or directly into your stomach, directly into your jejunum or ileum, wherever a tubing is placed, but the food is entering your GI tract. Okay, oral feeding, what you chew with your mouth and swallow, that is also enteral feeding method. Tube feedings, all forms of tube feedings come under enteral feeding method. And preferred, if your GI can function adequately, means it is producing enough mucus, it is producing its gastric juices. Okay, it has a peristalsis moment intact. Okay, if the functioning of the GI tract is well and good, you go with enteral feeding. If at all the GI function is bad, okay, whatever you are going to feed the patient through mouth or even through any tube feeding, but the GI function is going to be inadequate. Okay, there is not going to be any peristalsis. There is no gastric juices being secreted. Okay, in such situation, it is parenteral feeding that we opt for. It means uh, the nutrition is added into your blood vessels, either through veins or arteries. Okay, so people who do not have any good GI function, for them, this is the only option. So these are the different forms of uh, nutrition. First, we will look at the enteral nutrition. So any liquid supplement or any nutrition that is taken either through mouth, or if it is given through any feeding tube, it comes under enteral nutrition. So The first form of tube feeding is nasogastric tube feeding, NG tube feeding, okay, in which through the nostril a tube is inserted and it ends at the fundus of the stomach. This upper part of the stomach is called fundus of the stomach, okay. So a nasogastric tube is inserted through the nostril, it ends at the fundus of the stomach, and the food will be given through piston of a syringe. It is given through, it is pushed into the NG tube, and it reaches the stomach. Okay, so nasogastric tube feeding is one form of it. Next, you have nasoduodenal tube feeding. Again, the entry point is nostril, but the end point of the tube will be your duodenum. You can see this C-shaped area. Okay, after at the end of the stomach, from there, C-shaped part of your GI tract, which joins into your small intestine. This C-shaped part is the duodenum. Okay, so tube will start from the enter through the nostril and at the duodenum. The third is nasojejunal. So it is much longer. Tube will enter to the nostril and it will end at the jejunum. Jejunum is the first, it's a second part of your small intestine: duodenum, jejunum, ileum. Okay, these are the three parts of your intestine. Am I audible now? Okay. Next type of enteral feeding is through gastrostomy. Ostomy means an opening is made, okay, in your abdominal section, and a tube is inserted through that opening directly into your stomach. Okay, feeding tube that leads an artificial external opening into the stomach. Why is gastrostomy opted for? If you have any swallowing difficulty, okay, if there is any cancer, tumor which has been removed, a part of a jaw has been removed, if there is any obstruction in the esophagus, okay, in such conditions people go for gastrostomy. Okay, and then jejunostomy. If the in gastric bypass surgeries and all, if the stomach function is inadequate, esophageal stomach function is inadequate, in such cases, another opening is done directly into the jejunum, which can lead the tube into the jejunum, and the feed can be given directly into the jejunum. Okay, and whatever food you give in jejunostomy, it is partially digested food. Usually, it is hydrolyzed food that you can give. Regular food you cannot give through jejunostomy. It has to be partially hydrolyzed or completely hydrolyzed food. Okay. Next, coming to the parenteral nutrition, which means in the veins, okay, through the veins, when you use the veins to give nutrition to the body, feeding intravenously, bypassing the usual process of eating and digestion. Okay, so feeding through central vein, central vein, superior vena cava or inferior vena cava, anyone can be used. So central veins have a bigger circumference. Okay, superior vena cava, inferior vena cava, they have much bigger circumference. So what happens is that as soon as you give the nutrition through the superior vena cava, big veins, it immediately get mixed up with a large quantity of blood, and it can be given back to the body quite easily. Okay, When you feed through small veins, the mixing up of this fluid with the blood is at a very slower pace. Okay, so you have two options of parenteral nutrition, either through your central vein. Okay, CV line will be added, otherwise through your IV line. Okay, peripheral IV line. Through that, peripheral nutrition can be given. Okay, so these are the different forms of nutrition. All these nutrition is given under a in a clinical setting only, not at a home care basis. So is it clear to all? It's IV fluids like DNS, dextrose, NS, other forms of fluids. Okay, you're not giving the nutrition like juice or anything like that, that this kind of food you're not inserting into the veins. Okay, it's IV fluids. Types of food: natural liquid food, when through the jejunostomy or not jejunostomy, nasogastric tube feedings. Okay, natural liquid food can be given, like whole milk, skimmed milk, eggs, some form of carbohydrate like cooked and strained cereals, their water, the starch water of the rice. Okay, sugar, molasses can be given, vegetable oil or cream, and fat, dairy fat. This should not be given because they will stick to the they will stick to the tube and it will cause some obstructions. Okay, so too much of sticky items are avoided. Then we can also give blenderized feeding, in which food is cooked, steamed, or boiled. Vegetables, fruits, or any kind of food, cereals, pulses, they are cooked, steamed, boiled, whatever way of cooking you can opt here. And then they are blended using enough amount of water to make it into a very thin liquid. Okay, which can pass through your nasogastric tube. Okay, thick liquids will not pass through the nasogastric tube, it will cause obstruction. Okay. So in blenderized feeding, cook the food, blend it using a blender, and then add enough amount of water to it, and then give it through the NG tube feeding. Water is added to this blenderized feeding to make the complete volume into 150 ml. Sorry, 1500 ml. It should give around 1500 kilocalories as well. Each ml should provide 1 kilocalorie, and the entire day's meal should give 50 gram of protein. And also the cost wise, it is affordable. You don't have to buy any store bought nutrition or anything like that. Whatever cooked food you make at home, steamed, boiled, okay, whatever vegetables you have, cereals or pulses you have, boil it, steam it, and then blenderize it, add water into it to make that the entire volume, along with the blenderized food, and plus water, the entire volume should be around 1500 ml. Okay. Inserting the NG tube is little bit uncomfortable. Okay, it will only if the patient has a lot of nasal polyps and all, it will be little bit uncomfortable. Otherwise, once the tube is in, it is not uncomfortable at all. Once you insert the nasogastric tube, it will stay there for a week or so. Okay, the tube will be using a sticky tape. Tube will be fixed at the cheek or around the neck of the patient. Syringe is used. Okay, not with the needle. You remove the needle. A 10 ml syringe. Usually it is a 10 ml syringe which is used. End of the syringe is put into the nasogastric tube opening, which is near to the face of the patient. and then just pour. You have to hold the syringe up using gravity automatically. Because of gravity, whatever you are pouring into the syringe, it will go into the NG tube feeding directly into the patient's stomach. Okay. 10 ml syringe, 15 ml syringe, these can be used for NG tube feeding. Elemental diets. So elemental diets, I guess you would know by this famous names called Herbalife, Nutrilite, the powders, which completely substitutes the breakfast, lunch, protein shakes. Now you understand what is elemental diet. Normal food, which is replaced by these powders in terms of like protein powder, Herbalife, okay, Herbalife meal plans, right? So these are elemental diets. The patient who is on NG tube feeding and all, okay, yeah, meal replacement shakes and all. If it is, if you remove the lumps and everything well, right, you can give the patient elemental diets as well. It's suitable for the patients who are on NG tube feeding, but only what is recommended by the doctor, which kind of formulation or which kind of food supplement or which kind of elemental diet is recommended by the physician. Okay, you can use that. Because the protein which is used in elemental diet may not be completely suitable for the patient. What kind of amino acids are present in this combination, what is absent, okay, it has to be some amino acids. If it is absent, it has to be added separately. Okay, so these all formulations will be given by the physician, and the nurses can prepare it and they can give it as a NG tube feeding. So types of food. Continuous feeding. Continuous feeding is usually done in ICUs, okay, via feeding pump or through infusion pump. You have infusion pump and feeding pump. So what it does is that these pumps are like electric devices, okay. They control the amount of feed that will go into the patient's body. Infusion pump will control the amount of fluids that are getting inside the patient's blood vessels. Per hour, how many drops has to go. You have to just do the settings on the infusion pump, and it will control the infusion throughout the entire day. Okay, the settings are done by the doctors and nurses. Usually the nurses do the settings. Feeding pump also, it works in the same way. So that what happens is that once you put a patient on a feeding pump or infusion pump, you do not have to go back again and give patient breakfast, lunch, dinner, or anything like that. This infusion pump or feeding pump will take care of the patient's nutrition throughout the entire day. Okay. Hydrolyzed means you take any carbohydrate, it has carbon ions, along with that it has hydrogen ions. Okay, hydrolyzed means hydrogen ions are removed, hydrogen bonds are broken from the carbohydrates. Okay, that is the meaning of hydrolyzed. Lysed means breakdown of hydrogen ions. Okay, it happens in your stomach as well. When the food gets mixed with stomach acids, stomach contents, hydrolysis process starts. Then we have cyclic feeding. So it is an off and on periods. So 8 hours out of 24 hours feeding is ongoing, and 16 hours there is no food. Something very similar to your intermittent fasting, but in intermittent fasting you are eating through your mouth. Here the patient is put on infusion pump or feeding pump, which will work continuously for 8 hours. Infusion pump or feeding pump will work continuously for 8 hours. Remaining 16 hours, it will be shut down. The patient is not given any nutrition. Next day also, the same 8 hours. The infusion pump, feeding pump will be working. Then 16 hours off. Okay. Then we have intermittent feeding or interrupted feeding. So you can see how in time how they have divided it. 8 times a day feeding is given, 4 hours feeding is given, 4 hours feeding is not given. Okay, every 4 hours, like that, feeding is given continuously, and then it is the next 4 hours no feeding is given. After 4 hours, again continuously for 4 hours feeding is given. Okay, and this is given for 20 to 60 minutes continuously. The feed goes on, and after 4 hours, again 20 to 60 minutes continuous feeding is given. Okay, almost for half an hour or more than half an hour continuously feeding is given. Then 4 hours break, again when continuous feeding will be given after 4 hours break. Okay, so that is intermittent. Then we have bolus method of feeding, in which over a short period of time at a specific interval, using gravity or during using syringe, a bolus means a big amount is given suddenly. Okay, large volume of food is given in a very short time. For example, 200 ml of fruit juice or 200 ml of infusion is given within 10 minutes. After 2 hours, again 200 ml is given within 10 minutes. 200 ml is given within 10 minutes. So every 2 hours, a break is kept. But when the food is given, when the nutrition is given, large volume of nutrition is given within a very short period of time. Okay, that is the bolus method. Okay, so these are the 4 different feeding techniques. Is it clear to all? Two hundred cc is equal to 200 ml. So sometimes we can use cc, sometimes we can use ml. Both are same. Okay. Now coming to total parental nutrition, TPN. So all the nutrients essential for the patient's survival, patient's body's homeostasis, is given through parental route. Nothing is given through mouth. Nothing is given through enteric route. Everything is given through parental route, specifically your bigger veins, superior vena cava. Okay, big veins of is used in TPN, total parental nutrition. Okay, partial parental nutrition, that is PPN, 50%, about 30 to 50% of nutrients are given through your IV line. Okay, like putting the patient on DNS, NS, dextrose. Okay, so these all comes under partial parental nutrition. But along with that, the patient will still eat. You must have visited somebody in hospital. They are getting the hospital food, but they are also put on IV fluid. Okay, they are eating hospital food, they are eating a hospital diet, they are admitted. Okay, but along with that, there is an IV line going on for them. They are getting infusions as well. That is PPN, partial parental nutrition. TPN means they will not be given any food via mouth. All the nutrients are given only through infusion. Okay, that is the difference between PPN and TPN. So it's also called central nutrition, CPN, central parental nutrition. Why? Because you are using the central vein, okay, for the for your infusion purpose, or hyper elimination alimentation. That is also another name for TPN. So large amounts of nutrients in a hypertonic solution can be supplied via TPN, because this catheter, that is the central line, we call it central line, which is placed into the superior vena cava. Superior vena cava is the big vein of your heart. Okay, it has a much bigger circumference as compared to other tiny blood vessels. So as soon as this solution is enters the superior vena cava, it will get mixed up with the blood very easily. Large amount of blood is also present in the superior vena cava, which is circulating. Okay, so why the reason that larger amount of nutrients in a hypertonic solution. Okay, hypertonic means it has more concentration of nutrients. It's not hypotonic. It does not have more water. It is not diluted. It is concentrated, hypertonic. Okay, so this concentrated amount of for infusion can be given through your superior vena cava, because it has larger diameter. It has a very high blood flow rate as well. So quickly, whatever high solution, high concentration of nutrient you have just now allowed to enter the patient body, it is getting diluted very soon into the in the large volume of blood that is present in the superior vena cava. Okay, so that is the purpose of using central line. What are the complications with TPN? You will find a lot of tables here in total parental nutrition, but please don't read that. It is only for the doctor's use. It is only for the medical healthcare facilities use. It is not for regular home care use. Okay, so you don't have to study about the tables. So infection, that is most common complication. It's a healthcare associated infection. We call it as CLABSI. Okay, central line associated bloodstream infection. Air embolism. Sometimes what happens is that if you are not careful of placing the catheter well, or placing the infusion tube well, there are high chances that bubbles of air can pass through from the infusion tube. It can go inside the veins. Okay, and that could be fatal as well. Okay, air embolism can be fatal as well, because if this air embolism goes and gets stuck in during circulation, it goes into your lungs, it will block the airway passage, and the patient will pass away within few minutes. Okay, air embolism can literally kill the patient. So that is one complication. Hyperglycemia, too much of, because you are giving concentrated form of nutrition through TPN. Okay, it could lead to hyperglycemia. It was too much. The load of carbohydrates given to the patient, dextrose given to the patient, was too much, and sometimes it is too little. Okay, if the physician was wrong with the dosage, if the physician was wrong with the prescribed dosage, it could lead to imbalance. Okay, it can lead to either hyperglycemia or hypoglycemia. Electrolyte imbalances can take place. Fluid balance disturbance, acid base disturbance. Okay, these all are the complications with TPN. Coming to refeeding. Refeeding is a situation in which it's a refeeding syndrome. It's a complication. Okay, if you have put the patient on enteral feeding or parenteral feeding, okay, for a particular amount of time, there is a shift of anabolism and catabolism that takes place. Okay, the patient may get refeeding syndrome, in which the all the intracellular shift of electrolytes that that goes into a stage of anabolism. Anabolism means they compile together. Okay, it will lead to too much of insulin secretion. Lot of nutrients now it is present. It does not know what to do. Lot of glucose is present in the body. Lot of amino acids or fatty acids are present in the body, does not know what to do. It will go back into forming carbohydrate. Okay, or protein or fatty acids. Okay, and that will cause more complications. So you have given a lot of broken down nutrients, but the body will use this broken down nutrients to make a complete nutrient. Okay, so That is anabolism. That is a stage of anabolism. Catabolism means what? Breaking down. Anabolism means puzzle, all the puzzle pieces will come together, okay, to form something new. So what happens is that, why is it a syndrome? It can cause decrease in the circulating levels of various electrolytes, because when you are making something up together, okay, from bits and pieces, when the body is making something up together, it will consume all the circulating electrolytes as well in this process, and the circulating electrolytes will fall in your blood, okay, and that will lead to other complications. Hence, that's the reason why electrolyte levels has to be monitored for all the patients who are put on any form of TPN, PPN, or enteral tube feeding. You have to continuously monitor the electrolyte balance of this patient. So, what happens is that in refeeding, glucose load leads into the increased insulin secretion. As I mentioned here, hyperglycemia. Hyperglycemia is a complication of TPN. What is happening in hyperglycemia? Too much of glucose in your blood. That is hyperglycemia. Okay. So this excess amount of glucose in the blood will lead to increased secretion of insulin, because insulin has to bring down the blood glucose levels. Okay. So anabolism takes place here. So the glucose will excess glucose which is present in the blood will go and make more carbohydrates. Okay. Shift back, it will shift back to carbohydrate metabolism and protein synthesis. So what happens here is the cells will take up as much as possible. They will take up the glucose back. They will take up the potassium, magnesium, phosphate also back. The cells will take it up back from the blood. So what happens from the blood? Potassium, magnesium, phosphate, glucose levels will fall down, because imbalance has created. So increased anabolic demands deplete it depletes already low stores. As soon as the body goes into a state of anabolism, already you are malnourished, okay, and now your body is in a state of anabolism, okay, which means what? Already the body is malnourished, it does not have enough nutrients. What nutrients you have given, that also the body is not utilizing it. It is using it to make up its carbohydrates and protein. What was the original way how it was, it is going to make it into that original way. It is not allowing the cells to use it up for health, okay. So that is what happens in refeeding syndrome. Whatever nutrients you have dumped into the patient's body is not using it as it is supposed to use it for energy purpose or for health purpose. It is using it to make new components, okay. It will take away the potassium, magnesium, phosphate that is going that is in the circulating blood, and it will take it to make more other components, okay. So when the phosphate level falls in the blood, it will reduce the adenosine triphosphate, ATP. Okay, if ATP reduces, you are not getting any energy. So there will be an impaired production and utilization of energy. Adenosine triphosphate is used, is made so that your cells can produce energy. Okay, if phosphate stores decline in your blood, there is no way how adenosine triphosphate can be made by the cells. So no energy. Okay, so even though you are giving your patient all these fluids, enteral feeding, parenteral feeding, there is no energy production. So you can understand the patient is in a refeeding syndrome. So the various organ systems in the body is affected differently when a patient undergoes refeeding syndrome. In neurological, that is your central nervous system. Okay, there is an altered conduction of impulses. Okay, the way how you are supposed to react, the way how you are supposed to do things, your impulses are completely altered. You will be in a confused state. Some patients, it may go into a complication of seizures as well, fits, convulsions. In more complication, it could be coma as well. Okay, in cardiac system, cardiac output is decreased. There is low potassium, magnesium, and that could lead to cardiac arrhythmias. That is heartbeat. The way how the heart beats, heart rate is the rate at which the heart beats is not systemic. Okay, it's not normal. The rhythm of the heartbeat is not normal. Pulmonary system, there is a decreased contractility of the skeletal muscles, because of which you are not completely able to expand the lungs and keep pull in the oxygen. Okay, so respiratory system is compromised. The renal system, low serum albumin levels. Okay, edema all over the body, water retention can take place. Okay, so that leads to edema all over the body. Edema means swelling all over the body. Hematologic, that is blood. Impaired chemotaxis. Chemotaxis is required by your white blood cells to identify uh, if you have any foreign body invaders, any bacteria or virus has attacked you. It is through chemotaxis that the white blood cells will understand something new, something foreign has come, we have to take care of it. So chemotaxis function is impaired. Hemolysis is taking place. Blood cells are getting broken up on its own. RBCs are getting broken up on its own. That would lead to anemia. Okay. Poor platelet function and production. Okay. Wound healing will be suffering as well. So this is how refeeding syndrome can affect different systems within your body. Okay. So is it clear what is refeeding? Whatever nutrients you have given your patient to save the patient's health, the body of the patient is not using it accordingly. That is the bottom line of refeeding. You have to keep an eye out for the electrolyte. If there is an electrolyte imbalance, the patient is in the refeeding stage. Then medically it is managed. Symptomatic management has to be done by the doctors. Keep an eye for electrolyte imbalance. Do the blood work, and you will understand the electrolyte imbalance that is happening. Nutrition and wound healing. So this is something very generalized for majority of the population. Protein requirement is 0.8 to 1.5 per gram per kg body weight. If you are suffering from any surgery, or you are in a situation where wound healing is necessary, you may require 1.5 gram of protein per kg body weight. 30 to 35 kilocalories per kg body weight from fat and carbohydrate. Protein is not supposed to give you energy. Okay, your energy should come from your carbohydrate and fats. Protein should be used up for other major functions within your body. Fluid intake, 30 to 35 ml per kg body weight. Micronutrients, slightly higher than your normal consumption, specifically vitamin C, zinc. These are the micronutrients which you have to increase your intake when you are suffering from any wound healing, or you are looking for wound healing. Vitamin C, 100 to 200 mg per deciliter should be maintained in the blood. Before surgery, during surgery, and after surgery, what kind of focus you should look after when you're taking care of a patient? Okay, in pre-operative situation, make sure that the patient is well hydrated. There is no dehydration. Avoid excessive fasting. Otherwise, if the blood glucose level is also too low, if the patient goes into a stage of hypoglycemia, that is also dangerous during surgery. Okay, so avoid excessive fasting. Nil per oral is just 12 hours before the surgery, or when the doctor says. Usually it is 12 to 15 hours before surgery. But otherwise, even when the doctor says nil per oral has to be maintained, from that time onwards, the nurse will inform the patient not to take anything through mouth. Replace further losses in those with enterocutaneous fistulas and high output stomas. This is a medical management. Okay, any blood loss or any nutritional loss, if it is seen, fistulas are made. Fistulas are opening made between any arteries or veins or any other body part. Fistulas are made. It's an artificial opening, surgically made. So preoperatively, these are the things you have to take care of. Make sure the patient is well hydrated and the blood glucose levels are normal. Vital signs are also should also be normal before you get into the surgery. During surgery, maintain the fluid balance. This is for the nurses and the medical team present here. Avoid excessive fluid therapy during surgery. Balance the fluid using Hartmann's formula. That's Hartmann's formula is used to calculate how much IV infusion and what is the rate of IV infusion that should be ongoing when the surgery is being conducted. Use monitoring to guide fluid administration. Blood transfusion as indicated for blood loss has to be given. So intraoperative system, only the doctors, the surgeons, the anesthesiologist and the scrub nurses who are present in the OT, only they can manage this. Okay. Post-operatively, encourage early oral intake to understand that if the peristalsis movement is intact, if the gastric mobility is intact or not. Early resumption of oral intake means do not keep the patient on liquid fluid diet or clear fluid diet for a pretty long time. As much as possible, immediately try to give the patient solid food, not soon after the surgery, but speed up that process. Stop IV fluids once the oral intake is established. PPN or TPN. Okay, you have to stop it as soon as the patient is completely fine with taking food orally. And you have to aim for a state of zero fluid balance, which is you are not supposed to give any IV fluid. If the oral intake is inadequate, supplement with IV fluid. If the patient is not eating, patient does not have appetite, okay, the patient is has a conflict or it's a very challenging patient you have, okay, patient shows resistance to be fed through mouth. In such situations, you have to put the patient on IV fluid. And if at all the oral intake after surgery, it is delayed, the patient is not able to take anything through mouth, only then you can consider for PPN or TPN. Nutritional support for burns in burns patients. Burn injuries produce profound metabolic abnormalities. Patient with burns will have great nutritional requirements, specifically in terms of dehydration, in terms of making the blood glucose levels normal. Okay, nitrogen loss that has to be corrected with protein. So they go through a lot of abnormalities in terms of nutritional state, hypermetabolism, requirement of wound healing. Okay, so a lot of help is required here to nutritionally support a burns patient. The goal of the nutritional support here is to promote a state of nitrogen balance, because whatever kind of wound you have, not just burns, even when you're doing a surgery, okay, a lot of nitrogen is lost. Whenever you are wounded, a lot of nitrogen is lost. And how do you get the nitrogen balance in your diet? Only through protein. Protein is the only macronutrient which has a nitrogen ion attached to its chain. Okay, that's the reason why we call it as an amino acid. Okay, you don't have nitrogen ion in carbohydrates, neither in fats. Only in proteins you will find nitrogen ion. Okay, so whenever you are wounded or whenever, even if you're doing a surgery, you get hurt, okay, burnt, nitrogen is lost from that wound, from that wounded area. Okay, so that balance has to be created within the body. So nutritional support is completely based on the patient's burn status or the percentage of the total body surface area burnt. TBSA means total body surface area burnt. There are different ways of identifying how much is the percentage of burns. We have the five palm method. There are different formulas, okay, 4 to 5 different formulas are there, in which the doctors can understand what percent of the body surface area has undergone burns, and also what degree of burns, first degree, second degree, third degree burns. So based on this subjective data, you determine how much fluid balance is required, what kind of nutritional support is required will be determined. Feeding usually begins immediately or at least within 24 to 72 hours post burn injury. Enteral route is usually preferred. Jejunal feedings are also frequently used here to maintain the nutritional status, because you are supposed to provide protein. Okay, dehydration you can correct with IV fluids, but here the patient requires protein. Okay, so enteral route is preferred because you have to put that protein in the patient's body as much as possible and as soon as possible. Maintain nutritional status with lower risk of aspiration, because uh, when you are giving any enteral feeding through mouth, if the patient is swallowing it, there are high chances that the patient will aspirate it, which means food, instead of going into the stomach through esophagus, it goes into the windpipe, into the trachea, and that could lead to other complications, coughing, pneumonia, and so on. Okay, but when you're giving them jejunal feeding or enteral route of feeding, there is no way any food can uh, be displaced into the trachea. It will go straight into the stomach. Okay, so also with patients who have poor appetite, they don't have hunger. You can imagine a burn patient will not have an appetite. They are in much more pain. Yeah, clear fluid diet can be used here through nasogastric tube feeding. Strained clear fluid diet. Weakness and other problems are seen here. So these are the nutritional support you have to give for the burns patient. Protein loss is dependent on the extent and depth of the burn, the degree of the burn, and how much of total body surface area is burned. So these were the